I've been feeling so down, yeah. Can you tell me why? Can you tell me why I'm down, yeah. No friends of mine, no friends of mine around, yeah. Now I'm thinking I might have caught the June blues, yeah. I wanna drown myself inside the juice, yeah. You know I keep on running from the truth. Was that not? I'm just a lonely fucking you. Now when I travel.
Good day everyone! So today I'm gonna perform physical assessment on pediatric patients, particularly in adolescents. So their age group is from 11 to 19 years of age and subdivided into 3 categories: early, middle, and late adolescent. Usually in this group of patients, when they go to the clinic, they are accompanied by their parents or their relatives, and the most concerning for them is their body image. Because in this period, they are undergoing changes that affects them, and this is the time when they are mostly influenced by their peers.
It's really important to wash our hands first to get rid of microorganisms in our hands.
So, hi Emgelica, I'm Dr. Arrianne Fernandez, and I'm going to perform a physical assessment on you today. So you will just sit down, and if there's any uncomfortable on the procedure, just tell me, okay? So for the skin, we will only use inspection and palpation. So for the inspection, we will inspect the skin, its color, and if there is any lesions in the skin. And for the palpation, we will perform the skin turgor test. So it is either in the lower arm or in the abdomen of the patient. So if we pinch and release, if it immediately goes back to normal, then there is a good skin turgor, and it is a sign that the patient is well dehydrated. So for the head, there are only 2 techniques that we are about to use: the inspection and the palpation. So for the inspection, we have to check the color of the hair, if it is dry or coarse, and if it is evenly distributed, and if there is any signs of alopecia. So for the palpation, we will going to palpate if there is any signs of mass or tenderness in the head of the patient.
For the assessment of the eyes, we will use inspection and palpation. For inspection, we should observe for the external structures first. First to note is the ocular symmetry, the eyelid symmetry, the color of the sclera, the conjunctiva, the pupils, and the iris. We should also take note for any abnormalities or unusual findings we may find during inspection. One to note is drooping of the eyelids or any ketosis of the eyes. So normal findings should be the upper eyelids cover the small portion of the iris, cornea, and the sclera when the eyes are open. No ptosis noted, meets completely when eyes are closed, and then it should be symmetrical. For the lacrimal apparatus, lacrimal gland is normally non-palpable. No tenderness on palpation, and then no regurgitation from the nasolacrimal duct. To assess this, you should press on your client's lower inner orbital ring, and note that you are not pressing against the nose. After that, you can also test for your client's visual acuity. You can use either Snellen chart or a Jaeger's chart. Take note that when testing for visual acuity, you should test the eyes independently. Now we may now proceed for the assessment of the nose. For the assessment of the nose, we will also use inspection and palpation. We have to note if there's any deformities in the nasal bridge or the external structures of the nose. Then next, we will proceed for the inspection of the internal structures of the nose. We can tilt the head of our client and then observe for any septal deviation and the turbinates and observe if there's any blockages inside the nose. We may now proceed to the palpation of the sinuses. We should palpate over the frontal, ethmoid, sphenoid, and maxillary sinuses, and then take note if there's any tenderness or pain that the client might feel. Next, we will assess for the ears. We will also use inspection and palpation for the assessment of the ears. For inspection, we should inspect for the symmetry of the ears, the level of the ears, or if there's a long, steep ears, that could be indicative of trisomy 21. Note for any skin tags or any abnormal discharges coming from the ears. For the inspection of the internal structures of the ears, since our client is an adolescent, we should pull the pinna upward and then backward. We might also need the use of an otoscope for a clear visualization of the internal structures. For the assessment of the mouth, you can take note of the dryness of the lips and then ask your client to open her mouth, and then you can make use of a pen light and a tongue depressor to see further, and then take note if there's any tooth decay, enlargement of the tonsils, if the uvula is in the midline, if the client has a pinkish oral mucosa, and the size of the tongue. And then take note of any abnormalities you may observe.
So for the neck, we have to do inspection and palpation. We're just gonna observe if there's any neck whipping and indicated for Turner syndrome. And then for palpation, we will palpate the areas of tenderness or if there is any mass or presence of lymphadenopathy. So a while ago, we're already done with the ears. But as we palpate, and we will start from the ears back and then to the neck. Preauricular, post-auricular, occipital, parotid, cervical, submental, submandibular, and supraclavicular. So for the chest and lungs, you could actually use palpation, percussion, and auscultation, and to do this systematically, we must perform everything in front of the patient. For the inspection, we will inspect the symmetry of the chest, and if there's any flail chest, barrel chest, or pigeon chest. The chest area should be symmetrical as the patient inhale and exhale, and for the palpation, we will palpate if there are areas of tenderness. Next is percussion. Using our two fingertips, we will percuss and listen to each side. And then, next is auscultate. Using the stethoscope, we will instruct the patient to inhale and exhale deeply.
So now we go to the abdomen. In this procedure, you have to drape the patients properly. Since the abdomen is only what we need to cover the rest of the parts of the patients. For the inspection, we have to inspect the abdomen for the contour and the shape. If it's globular or flat. We have to inspect also if there is any piercings in the navel, and we have to inspect if there is any lesion. Next, we have the auscultation. For the auscultation, you have to imagine there's an imaginary line dividing the abdomen into the quadrants or region. Now, these quadrants or regions, you have to imagine the underlying organs. So as we do our auscultation, we will be able to know which organ is primarily having the problem. Okay, next step is using the percussion. Now, using our fingertips, we will top each quadrant. Last step, we do the palpation. For the palpation, we have light and deep. First, we need to do the light palpation. Always remember to ask the patient if there is any pain in those areas. Next, we do the deep palpation. So now we go to the private parts, such as the breast, the genitals, and even the rectal exam. First, we need to ask the patient's consent or even the patient's parent in order for us to be able to do it. Because, for example, if there is any history of sexual abuse. Okay. So assessing the genitals is very vital. So we need to inspect the patients for any hemorrhages or any trauma in that area. And of course, we need to palpate for any areas of tenderness. For the rectal exam, we need to inspect for any hemorrhoids or bleeding in the anus, for unwanted sexual penetration. And at this point, we can actually use the Tanner staging as the vital areas are already. So now we go to extremities, both upper and lower. We do inspection and palpation. So for the inspection, we need to inspect if there's any signs of cyanosis by looking at the patient's fingertips. And we also need to inspect if there is a polydactyly or syndactyly. And we need to inspect also for any clubbing of the fingers and the range of motion. And also we need to inspect if there is any muscle atrophy. Next, palpation. Assessing the patients for the capillary refills. So the normal is less than 2 seconds. So we do it by pinching the patient's fingertips and release. So it should go back to normal efficiency. That is the usual findings for extremities.